tumor size is about 3.5 by 2.5 centimeters, and that was the tumor we originally planned to treat. And when we scroll down, we can see there's another tumor at the posterior lower pole of the same kidney. The tumor's diameter is about 15 millimeters. It's a very small tumor. If this tumor was the only tumor in this kidney, we might not have treated it at all and chose active surveillance, but because this is an additional tumor in a kidney we're already treating, we cannot leave this tumor untreated. Because we're treating two lesions in the same kidney, we have the privilege of having two IceCure machines. We will use two cryoprobes with their matching introducer needles. And because we want to do a biopsy of each of the tumors, we will use a few TrueCut biopsy guns. We can see that the upper tumor is located here in the posterior medial part of the interpolar region of the left kidney. It is about 5.5 centimeters deep from the skin, and the entire depth of the needle that we will have to enter will be about 8.5 centimeters. This is the plan for the our approach to the upper tumor. This is our radio-opaque marker, and this is the trajectory of the needle. We made some measurements to see the depth to which we'll have to insert the needle. We scroll down to the lower tumor, which is here. That's it, very small one, also quite accessible. I think we'll go from the radio-opaque marker itself. The depth of the tumor is about 7 centimeters, and the total depth of the needle that we'll have to insert is about 8 centimeters. The introducer needles are basically a coaxial system for the Cryoprobe device. They fit exactly in length with the Cryoprobe. And I will use these coaxial systems to take the biopsy, to aid me in taking the biopsies and then inserting the cryoprobes themselves. The depth is about 5 centimeters. There are depth markers on the needle itself. So this is roughly the first. So now I've inserted both introducer needles, and now we'll do a scan to see the exact position of these needles. We are ready to start the freezing. I will insert the cryoprobe first into the lower pole lesion. It's important while removing the inner stylet of the coaxial needle to stabilize the needle itself so it will not move with the motions of the stylet. Again, if there's no blood, I will fill it with a bit of saline just to prevent air bubbles between the cryoprobe and the introducer needle, which will interfere with heat transfer. And again, I stabilize the introducer needle, insert the cryoprobe all the way in, and start the freezing cycle, Vaksha. And I hold it in place for about 1 minute for it to do the initial freeze and stick in place. It's very important not to bend the needle or the introducer needle during extraction to prevent cracking. The only motions I do is I try to twist, which will release, and pull straight out. I avoid bending it in either direction. There's no blood coming out of the needle, and we're fine. I'm ready to extract the needle. I push the extraction button, and now the machine will switch to active heating in order to enable me to remove the needle as fast as possible from the ice ball. And I will inject a bit of gel foam through the introducer needle. That's it. This is the final scan after extracting the needle. We see still the ice ball. The fat is thawed and the ice ball the tumor remained frozen. There's a bit of air from the gel foam I injected in the collecting system. And along the tract, we're fine with that. We're not worried about it. Procedure went as expected without any unusual complications. Mild peritumoral hematoma in the lower pole lesion is something that is expected after biopsy of kidney tumors, which we know tend to be very vascular. And we're happy with the procedure.